रेडियो मेघपियोन बीते हुए दिनों के यादें, कुछ गाने, कुछ बातें.
Hello, Meghpeon listeners. December has started. The year has passed by really quickly, and now we can see winter has already set in Sweden, whereas the southern countries are now enjoying summer, right? So I'm pretty sure that you are enjoying your days no matter where and which part of the world you are in. Here in Sweden, since the days are dark and a bit gloomy as compared to the brighter shades of autumn and sunny days of summer, we thought of bringing in a very important topic on mental health and well being, which pretty much depends on the surroundings that we live in. Today, I have with me Subhamita Maitra. I'm certain you have heard her name several times on Meghpeon, as she usually is on the other side of the microphone, where she hosts several occasions and several events of Meghpeon Radio. So today we have Subhamita with us, who is working in neuroscience at Umeå University in Sweden. She was earlier associated with University of Calcutta in India and Mahidol University in Thailand, and now here in Sweden. And she is pretty much connected to, as you can understand, the topic what we are discussing today, the mental health and well-being. This is a field which studies different molecular aspects of human behavior. And we will now bring in you, Subhamita. Welcome on board to
Thank you.
And it's a pleasure to have you here with us today. And would you like to say a few words to our audience today?
Yeah, of course. Like it's a very different feeling that I'm here, as you mentioned, that I always host the session. So it's really a new journey of Meghpeon. Like we are doing a Meghpeon chit chat, right?
Yes, yes.
So it's a chit chat between the Meghpeons. Yeah, Sampurna, as you said, that now it's really becoming a very important topic that we should cover up. Like the darkness is coming, and we, especially we, the persons, the people from tropical countries, we always do not understand how this light impacts our mind. And so, yeah, I think it's a very good time to discuss about it. The journey is yours, so you can.
Yes, yes, for sure. And let us take the best, a very good utilization of this time, I would say. And let's begin with, like many of us do not really understand. Like when I say, how are you? People say, I'm fine. And that's a very rapid answer that we've been given since childhood. And now, how are you has gone beyond physical wellness. And I'd like to hear from you as you're pursuing your career in neuroscience area, that what is mental health that we should be aware of?
Yeah, this is a very good introductory question, I must say, because we still do not have much awareness about mental health. So, if I say in a very brief note, because mental health is a kind of umbrella term where you can find a lot of multidisciplinary informations together. So, in a brief, mental health is something that is the health of your mind. And what is your mind? Mind is all about what you think, what you feel, how you behave. So it's basically a health of your thought process, of your emotional state, how you behave, how you handle situation, how you interact socially. This all come under the mental health thing. Now you have introduced a very good statement that when everyone says that how are you, we generally say, yeah, I'm fine, I'm good. So basically, if we think, we always try to stress upon on our physical responses. Like if I'm not having some underlying disease in my body, so I feel
Mhm.
like I'm fit. But actually, health should cover this bodily response as well as how you are by your mind. And actually, this think in a very constructive way, how we are by our physiological responses and how we are by our thought processes are actually interlinked. So
Mm-hmm.
if you do not feel well, you actually cannot be well by your bodily responses and vice versa. So mental health basically works on this part where everyone in this field tries to develop different strategies to make you feel better, to nourish your mind.
Mm-hmm.
And mind is something which is very much within your brain. We earlier
Right.
used to say that it is our heart that gives the identity of mind.
Mm-hmm.
But of course, the part of heart, the part of our peripheral body that has a very much impact on mind. But if you want to localize your mind, it is certainly in your brain.
Mm-hmm.
So, if you talk about mental health in a research perspective, so it is certainly the study of this different perspectives of mental health.
Okay.
So, people from sociology, people from psychology, people from philosophy, people from biology, people from artificial intelligence
Mm-hmm.
all work in mental health. This is because when we talk about our mind, of course, everything cannot be answered from a biological perspectives because we still don't know many of our subtle behaviors, how that is regulated by brain.
Right.
Again, if we talk about the system that everything is a reflection of our behavior and we just escape the deep root of this brain, then we are actually I should say generalizing the mental health. So it's a
Mm-hmm.
very umbrella term, and the main researchers now focus on basically how to prevent and how to cure and how to make you a healthy person by your mind.
Mm-hmm. Yes, exactly. I think that's very an eye-opening thing that you say a healthy person by your mind. So when you see someone who is doing gym and having strong muscles, doesn't indicate that he's totally healthy. You have to dig into the mind to really know that this person is behaviorally also doing fine.
But I just want to clarify one thing about health. Health in general, and especially health in the context of your mind,
Mm.
that it is not like that. You can certainly define what is health. Like, if a person, let's say, anger is something which is very common to us. All of us sometimes, at some point of time, get angry.
Mm-hmm.
So that is not an unhealthy situation,
Yes.
but it can go to an unhealthy situation when there is an extreme case.
Mm.
So basically health is defined like the certain comfort that the person suffers from. It can be your bodily response or by mind. I will more specify about the mental health part of it. So it
Mm.
is basically first is the discomfort of the self. That means if I am the subject, how much
Mm.
discomfort I am actually feeling. It is many of the times noticed that the person who is actually having that problem, not problem I should say, but the issue, like the
Yes.
problem who is the person who is suffering from that issue, he or she doesn't admit that okay there is a problem, but the
Right.
person surrounding that person can
Gets to know.
understand there is a problem. So it can be a discomfort to that person or the discomfort of the surrounding person for
Correct.
for that person. So that is
Right.
one point of health, mental health. And the second point is like that, okay, there is a discomfort, but this is how much frequent and to what extent.
Mm.
Like if a person is angry, so does he get angry every day? What does he do when he becomes angry?
Yeah.
How much is the anger outburst? So it is always quantitative and qualitative. It is not like yes no always, and it is not like how much frequent. So there is a gradation of everything, how much and for how long.
Yes.
And the last thing that I will mention also for the health part of it, that is the social functioning and the functional capability. Like you may not have something very bizarre, you may not
Mm.
have something very specific, but you are not concentrating, you are not focusing, you are having some problem to cope up. So these also come under this mental health, and the
Okay.
term actually health.
Mm. Yes. No, that's really good. Thank you for explaining mental health so well, Shubhamita. I would like to know what kind of research you do in Umeå University or across the world. What kind of research happens around this mental health
Yeah.
as you're part of the research side?
Yeah, surely. So, as I mentioned already, that there are many perspectives of research. So, if we talk about only the biological research, it is mainly, mostly involved with the genetic part of it, like how a disease runs across the family. Then also, like if there is any genetic already genetic vulnerability, but how the environment modifies it, because everything is not in the gene and everything is not in the environment, so it is
Mm-hmm.
the interaction. So that interaction is well studied across the globe. And then you have a system neuroscience concept where you look at the imaging data, like MRI, PET, SPECT, this kind
Mm-hmm.
of EEG, like electroencephalogram. So this kind of studies that actually try to understand uh, how your brain is functioning.
Right.
So by a simple electroencephalography, when you get the wave pattern, you can get a prediction of how active is your brain.
Mm-hmm.
So there is another part as sleep research. So they work on the sleep.
Wow.
So another part is there. They work on the therapeutic part. So
Mm-hmm.
they try to predict what are the things in your you have in your body or in your mind, in the way of, like as I mentioned, EEG or genetics or anything that can help us to predict what kind of therapy is the best for you.
Mm-hmm.
So these are different part of research, and what I actually missed is there is also a very basic molecular researches that work on different like isolated systems like cells, tissues, not related to exactly your brain, but it is just like you can imagine that you are just taking a part of your brain and trying to experiment it. It's like that, but
Right.
it's not like you are taking a part of your brain, but it is like you are artificially growing some cells and try to mimic your brain. So these are the works that happen in biology. And if you ask me what I am doing here, I am basically working on the impact of daylight on human mind.
Okay.
So yes, so we have a glass house in the northern part in the Grano. So we have a glass house, and there it is completely transparent. Light comes through all the time, and we just try to understand how the light actually impacts, because here the light changes very quickly. So
Yes.
how our mind adapts to this quick change, and how
Mm.
our eyes adapt to this quick change, is there any relation between this adaptability when you talk in terms of health and unhealth? I would not
Mm.
say diseased, but health and
Yes.
not being health.
Not being healthy, unhealthy.
Healthy, exactly.
Yes.
So
Oh,
these are
okay.
the kind of researches that are going on.
Mm. That's so interesting. I mean, the more I'm listening to it, it's sounding like usually it's like a very commonly used term today, but a lot of research is going on behind that,
Yeah,
and so many.
it's really
Uh,
fascinating to
yes,
know
it's
human
very, very
mind. Yeah.
fascinating. And what, according to you, or according to these studies, what are the common reasons why people feel unhealthy mentally, or what causes it? And as an individual, how does someone come to know that the person is unhealthy? I think you've touched a bit on that, like you
Yeah.
don't feel comfortable or your
Yeah.
surroundings.
Yeah,
Yeah.
exactly. So actually you have asked two different things together, so
Yeah.
I just try
Hmm?
to dissect and answer. So
Hmm?
first one is what causes illness, mental
Hmm?
illness. So there I would say that it has number of causes. Like
Hmm?
when we talk about any diseases, not only the mental health diseases, even for other diseases also, so we see that all the things are so well orchestrated, all the processes inside our body, that sleeping one from the other is very common, it's very usual, but still we do not see that, we do not get that reflection in the system. So it
Yeah.
is already well regulated, but still
Hmm.
there are some things. So these things can be answered, this illness can be caused by different things. One is stress.
Okay.
Stress can do a lot of thing in your mind,
Yes.
and not only in your mind, in your body, but
Yeah.
the silent impact of stress is much more for your mental health. So one is stress. Number two is, as I mentioned, there can be some familial risks. So there can be some influence of the environment itself. And there are two things that I want to specify. One is how the developmental period you have, like how you were brought upon. It's not about parenting
Mm.
completely, but it's about the micro environment that you had during your upbringing.
Upbringing.
So
Mm.
that has a biological root, like biologically how nourishment you got, how your all systems develop this ones. And if you go about the theories, so there are different psychological developmental theories by Sigmund Freud, by Erickson. So they all talked about how a child grows on. So
Yeah.
if you have some problem there, so that will be imprinted, means that will be taken over for your lifetime. So the upbringing should be very specific, and that is the
Yes.
pillar of how you behave for the later on. Of course behavior changes, but the critical period during this development is very essential.
Yeah.
And another thing is that there are several diseases or disorders or discomforts in the children that come from the prenatal, like when they were in the mother's womb, or when they were
Mm.
just born. That
Yeah.
time if they have some difficulties, like if they have oxygen deficiencies, if they have
Mm.
very crucial infections,
Mm-hmm.
if they had some head injury, if they had some meningitis, so this can also lead later on to mental health challenges. But if
Okay.
you talk for the geriatric population, which is more than 60 years or something, so our elderly people, they develop neurodegeneration. Like
Mm.
we all very know about Alzheimer's disease, Parkinson's, cerebral stroke. So this
Right.
mainly happens for stress, for familial factors, and lack of after retirement, the rate of these diseases also increase because of
Increases. Yeah.
lack of your mental exercises.
Mm.
So this all things actually come together as a cause of mental health.
Yeah.
I cannot pinpoint only one. And the second one, as you mentioned, that how will you feel that you are unwell? So first, I say that you don't need to worry about whether I'm fit, whether I'm fit. You don't need to think like that. If you are not fit, you will understand by yourself, because you will not feel that comfort. Or
Mm.
sometimes you do not understand, you are not fit, you are behaving in a different way, so your friends and families will understand that. So for mental health, this is very important that you should monitor your behavior, and your peer group, that means with the group you interact in the day, day in and day out, they should also monitor your mental health. And if there is any problem, you will get to know by each of this process.
Yeah.
So that is the first thing that you should think. You should not worry about whether I'm fit or not, but if you are not fit, you will feel that discomfort.
Yeah. And what does an individual do if he or she thinks that he is suffering from mental health? Like,
That's
what do you suggest?
so that's a very good point. So first I say that I don't work as a clinician, so I have no
Yeah.
right to say about the therapy. But what I can suggest is that if someone feels that okay, I am having some issue, so
Mm.
first that person has to accept completely that okay, I can get this problem. This is very normal. Everyone can get this kind of problem, and so I have also got this problem.
Mm.
Now after recognizing that, rather after admitting that I have got a problem, I need to understand or assess what is causing this problem. I am not talking about what is going behind your brain, that you cannot understand. But if you feel low today, like if your mood is low today, you can certainly try to understand why I'm feeling low. And if you can find some reason, the first thing is that you can solve it if you can. And most of the
Mm.
time you will not be able to solve it, because that's why you are frustrated and you are feeling low. So that is, there is a very good thing to do, is to distract yourself from that. So
Okay.
if you try to practice that okay, I will not, so whatever environmental changes are going to be, I should not be influenced by that. But if you have problem, you will be influenced by that. So first of all,
Mhm.
you have to do your self monitoring and self regulation. If you cannot do it, you can talk to your friends, families, to understand, to share your problem. But only sharing your problem often will not give you some result.
Mhm.
So then if you think that you're having a lot of discomfort, then your professional life is getting hampered, and for children it is like their learning process, their school performance are getting hampered.
Mhm.
So that is the second point. And the third point is how much and how frequent it is affecting you. So if you
Yes.
see everywhere it is very alarming, or you really feel like you need a support, so there is a very good support system for mental health. You can always talk to some specialist. You
Yeah.
can even you can go for some pharmacological, like for some medicational help. And we have a very bad concept that this
Mhm.
kind of medical, like medicines that
Mhm.
we take for your our mental health, so that are very bad and that affect our brain. So most many of the children, many of their parents have earlier told me that, ma'am, he is taking this one, but he is taking this one for this years. And so ma'am, is it good? I
Mhm.
know from internet that it is not good. So
Okay.
actually it's not like that. Of
Mhm.
course, no medication should be taken lifelong until or unless your doctor suggests you. But within the particular range of safety, the medicine is prescribed to you. And
Mhm.
if you take that medicine within that particular limit, so it should not cause a real problem to you.
Yeah. In fact,
So
it should cure
exactly,
the person,
exactly,
right?
exactly.
Right. So, I mean, apart from like, I think you touched upon this. I was about to ask you that whether there are cures for mental health problems. So it's reaching out to people, um, immediate surroundings, distracting yourself. You can somehow try to cure it yourself, and then when it's really alarming, you
Mm.
can reach out to the professionals who handle this.
Yeah, so
Yeah.
distraction is something, distraction is one of the technique, and it is not applicable to all.
Mm-hmm.
Because for actually, you, I cannot say any generalized technique to how to control yourself, but it is actually looking at what is causing this problem and how can you solve it. If you cannot solve it, then how can you adjust to it.
Hmm.
So if you feel that you get angry out of not out of very simple things, so you must be coming out of the cycle that makes this anger iterates about itself. The
Yes.
same thing happens for your anxiety. If you get tense for certain things, so you try to think more and more on that topic, and
Mm-hmm.
again that gives you the same worry, so the worry gets doubled and the cycle continues. So it's,
Yeah.
you have to break that cycle. For depression, it is, I told, the distraction can be one of the things that when you're feeling that thinking of this thing can give me some pain, so it's better not to think about it. But the
Mhm.
problem is that the people who are suffering from this kind of problems, they cannot come out of it by
No,
themselves.
it will
So
keep
that is
on
the,
moving in the head.
exactly.
It's like
So
a.
if a depressed person
Mhm.
even thinks, he or she may have tried it a lot of time to come out of this one, but it is something that is not only your trial, it is something happening within your brain. There are different neurochemicals that go up and down, so it is not always possible that you can hold it over,
Yeah.
but you can try. So
Mm-hmm.
we can train our brain to do this, not to do this. And if you try this one within a particular time, like the time point within which the brain is plastic, like it can, okay, it has gone to this point and it can come back. So it's like
Mm-hmm.
elasticity, like we can exchange and then it comes back to its normal position. So brain can also work like that. But
Okay.
beyond that point, brain gets plastic. So there are some permanent changes that is happening. So you have to be very careful that how long you should try to handle yourself by
Mm-hmm.
you only, and when you should consult a person who is a specialist.
Yes. Okay. No, I'm very certain people who are listening now are totally enlightened by all these things you're telling it to us, because we are sometimes not aware of ourselves and how we are reacting and how are things going with us or our surroundings, even with people whom we are meeting every day. We can probably help to solve their problems as well, you know. Are the challenges same for men and women, or adult and kid? Are there different forms of it, or ways of recognizing?
Hmm.
Are the symptoms same in men and women, or
Uh, okay, this is a that's very
very difficult?
difficult
Very,
thing,
yeah.
but yes, certainly, yes, there are certain diseases, certain traits. I will not talk about only the diseases. In reality, also, if you see, there are certain features, certain traits, certain characters which are more frequent in females than males, and which are more frequent in males than females. So it is nothing about which is good, which is bad, but males and females, and they are different. And if I even generalize this gender, so the genetic makeup, the hormonal system, they are different. They are different, that's why on that influence the brains are different. So
Mm-hmm.
of course you have different expressions. When you have a disease, when someone has a disease, it is nothing like an alien word coming from other planet. it is it
Exactly.
is exactly your characters that
Mm-hmm.
have been, that have been modified. It is either it is you are doing something very highly, or you are not doing that. So it is not, it is very unlikely that you are doing something new, completely new.
Yeah.
So
Mm-hmm.
since your behaviors are different between females and males, so your disease phenotypes are also different.
Mm.
And if I say in that way, so females are at a much more risk to develop certain diseases, especially depression, anxiety, OCD. This kind of problems are much more prevalent in the females. At the other end, the narcissistic personality disorders, the antisocial personality disorders, the oppositional disorders. Well, this is all I'm telling you about the recent, the public, the research articles. I'm not going in the clinical data that you can find in hospital. So
Okay.
mostly it is the trend that this
Mm-hmm.
way these diseases are different.
Yeah.
And if you talk about the children are completely of different domain. So the problems they have are different, and for that reasons the mental disorders that has been classified by American Psychiatric Associations, or even for World Health Organization, they have also classified the ICD in the ICD-10 or 11, ICD-10, I guess.
Mm-hmm.
So these classifications always divide children group with as neurodevelopmental disorders mostly. Then the adolescents group, there you can find schizophrenia, bipolar, this ones, and that continue till your adulthood. And
Mm-hmm.
then later on you get that it's kind of degenerative problems. So of course the symptoms change from age to age, from
Yeah.
gender to gender, from individual to individual.
Yes. It's very individualistic. I can
Yeah.
imagine this is very personal mental health. And no, I think we have covered everything through our discussion today. If you think anything else is important for us to know, which I have left out, or y- you think that we should be aware of, because I saw you mentioning, the depression and sad syndrome, etc., which is very prevalent here, especially in
Hmm.
November. It's very dark. December is
Yeah.
dark as well, and January starts to brighten up here in Sweden, especially. Any tips that you have for us?
During this darkness, yeah, there are a lot of research going on. So how to combat this darkness? So one thing is that the light that you are using, it should be something which is similar to sunlight.
Mm-hmm.
So if you talk about the quality of light, now we all know warm light, cool light, with that different LEDs. So it's always better to have some lights which can mimic the natural daylight throughout the
Mm-hmm.
time.
Yeah.
And I will say that the blue light has some some different effects on your mind, on your sleep patterns. So the blue light should be avoided at night.
Okay.
But these things are also very much in the way you feel cozy. Like,
Hmm.
I don't feel very cozy with warm light. I like a much of cool light, a little white light. But
Hmm.
that doesn't mean that it is the light that you should use. So this light use of light is also individualistic, but it is always good to mimic the
Yeah, the
the
natural
natural
thing.
environment
Yes,
in
yes.
your light setting.
Very good. So I think we have almost come to the end of this episode of Radio Meghpeon. And thank you so much, Shubhamita, today for sharing so much insights about neuroscience, mental health. I know it's a vast area.
Sure. So I just, Shampunadi, will take a couple of minutes more. Just
Yeah.
I will say one thing that when we discuss about mental health, I should talk about the support system. Like
Mm-hmm.
when a person is not feeling well by mind, so the first thing happens to that person is that person becomes very much, like insecure. So, and it is not only India, or it is not only particular country, but all over the world, mental health is not given that much priority it should get. So
Right.
I will, through this Meghpeon, I will try to generate this awareness that mental health problems are also the problems that are very much involved to your physiology,
Mm.
your body. So your mind is nothing out of your body. So take care of that. If you feel some problem, please consult to specialist. And if we see someone suffering from problem, we should stand by them. So
Yes.
it's a more kind of awareness and being together to
Yes.
combat mental.
Social
Yep,
social
exactly.
responsibility, I
Yes,
think we
all
should
of
take
us,
for
for
each
all of us.
other.
Yep.
Yes. Thank you. That was very enlightening. Thanks again, Shubhamita, for joining us today. Thanks to all the Radio Make Beyond listeners. Stay well, stay fit, and stay happy.
Yeah.
And this is December, so before we meet next, if we meet before Christmas, I mean around Christmas, otherwise, I would like to wish you a Merry Christmas and a very Happy New Year. And hope you had a nice episode today and enjoyed listening to us. Thank you.
Thank you.
रेडियो मेक बियॉन बीते हुए दिनों के यादें कुछ गाने कुछ बातें